We're at the Global Conference on Pharmacy and Pharmaceutical Sciences Education, where FIP has just released a set of development goals on the pharmaceutical workforce. The first of these is all to do with academic capacity, and I'm here with Toyin Tofade, Dean of Howard University. Dr. Tofade, what does academic capacity mean?
Well, it's very important for us to have the right set of workforce individuals who are training our students into the correct pipelines for specialization and for practice, either in industry or in clinical areas or even in academia. So it's important for us to be able to make sure that the next generation of students that are coming through have the right training, the right context, the right skills, the right attitudes and knowledge base to be able to adapt to the ever-changing pharmacy that we have, profession that we have in front of us.
When it comes to academic capacity, how should the future look?
Well, it would be nice if we had a set of leaders that would serve as mentors for the next layer of leaders that are coming through. So you have a pipeline of leaders. It's like raising leaders. That's one of the things that I say in my college is that we're here to raise leaders to impact our world. So if, for example, I have a mentor who mentors me in the area of deanship, then I should be willing to mentor other people to be able to rise to become leaders or administrators or even faculty leaders, and then they should be able to mentor students, to be able to follow them, so that there is succession planning, so to speak, if you want to put it that way, and that we will never have that gap of generational gap in terms of who's available to teach those that are coming through. So capacity is not just numbers, but capacity is also in terms of the knowledge base that we're training in. So diversity in terms of government jobs, veterinary and pharmacy, clinical practice, research. We know that the research scientists, particularly in the U.S., there's concern that maybe that is shrinking because of a huge emphasis on the PharmD program. So we need to make sure that we focus on every single aspect of the pharmacy profession, not just clinical and research, but also the governmental type roles, regulatory type pharmacists, pharmacists working in nuclear pharmacy. So specialization would likely occur, just as it was said in the conference today, that we need to make sure that we have training outside of students, so residency training, fellowship training, postdoctoral training, to make sure that pharmacists are continually developed and we build that capacity to be able to take care of the patients, which is ultimately about the patients.
So one of the objectives of goal number 1 is to develop new methods to attract young pharmacists in all areas, including clinical, academia, nuclear, and veterinary pharmacy. What does this mean for schools of pharmacy?
I think schools of pharmacy will need to position themselves squarely in partnerships that will inspire the younger generation to want to go into those fields. That means bringing live individuals that are currently in those roles to talk about what their passion is about that field. If you're not passionate enough about your field, it is very unlikely that you would draw somebody into that field as well. And so it will be important to develop those partnerships and relationships and then provide fora for those specialized individuals to come in and talk to the students so that way they can begin to consider those alternative opportunities for practice.
Thank you.
Thank you.
This is Whitley reporting from FIP.